Hello. Yes, so we've been getting a number of inquiries about how things function through my hips. And quite frankly, it's one of the largest issues that most people face nowadays, is because we sit for long periods of time, and as a result, our hip mobility is greatly affected. There's two aspects of the mobility we're going to deal with today. So we're not going to get into all of the other dysfunctions that can happen. We're going to focus down on one. What we're starting with is therapy. When we want to remedy something, we do therapy first, and then we do rehabilitation second. Quick reason on why. Why is that done that way? I can make everything stronger, but if I still have something that's too short to function properly, it's going to determine how effective my joint moves. This is why stretching is important. The stretch we're going to work on is called a hip flexor stretch. I'm setting up where I have a relatively wide base between my left and right legs. I'm down on my left knee, just in case the camera is reversed for you, and my right foot is stepped forward. The alignment I'm working on here is a position where I have the knee and the hip and the shoulder all aligned vertically. To start this stretch, I'm going to start activating the stabilization of the hips. What I'm going to try to do when I'm activating stabilization is begin to correct a problem that we see in a lot of people, which is what's called anterior pelvic tilting. Sometimes it's posterior, most of the times it's forward. I'm going to use my thumb to represent the ridge of my pelvic girdle. Normally, I should have a relatively level pelvic girdle. What happens is we have a rotation down, and that's generally because these hip flexors have shortened, and that pulls that whole structure down. So, to start the reverse process, if you can imagine the pubis area, which is really the base of your pelvis, there's a muscle attachment there that's a big muscle that helps us pull it up. That's your rectus abdominis, your six-pack muscle. I'm going to refer to it as the six-pack engagement. As I start to pull that muscle, I want you to kind of pull up so I can feel the base of my pelvis kind of like rotating up and pulling upward. As I start that activation, I'm going to add in a secondary muscle, which is on the posterior side. It's my butt. That's the gluteus maximus. I'm going to start engaging that muscle. So as I lift and as I engage, what's happening is my hip starts to push forward slightly. And the muscles that interact over the hip, our hip flexors, start to lengthen out, which is what we like. That's what we want. We want those muscles active. Now, I'm going to actively stretch. I'm going to push my hips slightly forward to create a little more length in the muscle. So as I push forward, my hip's going into more extension, which means those muscles have to lengthen out. So I'm going to hold on this 30, 60 seconds, and then I'm going to switch up. The frequency at which we do this is 2 or 3 times on each side and 3 or 4 times a day. The reason why this is a benefit is that in many cases, people just try to strengthen, and you can see the results of just doing that particular thing. They want to rehabilitate how they walk, they want to rehabilitate, and they want to do all these other things, and they can't understand why when I go to step forward, it's not very easy for me to do. Or I overstride. I simply throw my leg forward and have my heel strike the ground, and I walk about, and I can't understand why my ankles, my knees, and my lower back, and my hips also feel so miserable. It's because you're not walking correctly. So therapy, the stretching, gets you back to functioning better. And there's some important things to also remember about what not to do. In many cases, we try to mirror what we see other people doing. And this is like a very usual yoga pose, where we have a lot of opening through the hip. The reason why that's not necessarily an effective way to release your hip flexors, although there is a hip flexor release, is that if you watch what's going on with my pelvic girdle it's not necessarily rotating upwards, and it's not necessarily being an effective release of some of the muscles that are involved with hip flexion. Although there is a greater angle, or appears to be a greater angle, what's typically happening is my lumbar spine, which is fused into my pelvis, has gone into flexion. You can see that I can basically bring a lot of flexion to that, and I can also extend my thoracic spine to make it look like I've really opened up that whole structure. And there's a fallacy to that. It has opened up, but it's not being effective at stretching the specific muscles that we want release on. What it has given you is more compression in your lower back, your lumbar spine. And that is what we're trying to avoid by doing certain things like that. Doesn't mean that that's particularly bad. It is a specific exercise that helps to strengthen other muscles on the front part of our body while we also engage the back muscles, but nonetheless, it's not effective for what we're trying to stretch today. Another thing for consideration relative to hip mobility, a lot of times people will do hamstring stretches, hoping that that'll help clear up a lot of their lower back issues. The reality is that the hamstrings control almost about zero movement of the hips. If I lift my foot and I engage my hamstring, what really wants to move is my lower leg, and that's the muscle. That muscle itself works with the knee joint in particular. It's one of the primary movers of the knees, bringing the knee into flexion. So stretching that to help alleviate hip flexor problems is not necessarily going to bring you any relief for that. It's better for your knees and issues relating to the knees. One of the big benefits of getting the hips and the hip flexors to work more efficiently and getting them lengthened out is how you walk. If you walk and you have your heel striking out in front of your body, you're walking incorrectly. There's a lot of orthopedic issues relative to overstriding. A good way to know that you're overstriding or stepping too far away from your body is walk on a wood floor. Yeah, simple as that. If the floor makes sounds like you're walking like an elephant, I will tell you that you are overstriding. Your length of stride is too long. It's very important that when you step forward that you have your foot, the pad of the foot, maybe even the mid part of the foot, if you will, be the strike point of your step. Striding. Some are trying to be corrected with shoes. You get a bigger cushioning on the shoe. The thing what we want to do is lengthen out these muscles in the front so we can derive the benefit of being able to walk and run better, which is really being able to pull our leg through as opposed to step it forward. It's going to give us more control over our movement, and it's going to take a lot of the stress off of our lower back when we get those muscles lengthened out.
So when you do step your foot forward, where should you be landing on your foot?
Just like that. That whole pad of my foot, the ball of the foot, all of the arch under my big toe to my little toe has a nice padding for my body to kind of set down upon. Functioning better. Every day. You got to practice this. If you sit every day, you should stretch every day. Let's release from this. Let's come back up. So that's the first stretch. Told you how to execute it. Told you why it's important and the benefit from it. It's just functionality. You get better use out of those muscles that help you walk, that help you lunge, that help you remain stable as you move. Have a great day.